Evergreen Media Network Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Treasure Coast Connector, connecting residents and businesses of the Treasure Coast. And here's your host, Ellen Contreras.
Welcome to Treasure Coast Connector. I'm your host, Ellen Contreras. Treasure Coast Connector is the talk show, an online community where we put a spotlight on interesting local businesses and resources, then connect them to you, the consumers in the community. Everyone has an interesting story of why they do what they do. When we learn about what's happening in our own backyard and support local businesses, it strengthens our local economy. For details on the show, links to discounts, promos, past interviews, check out www.tcconnector.com. Well, many people don't realize that our overall health is affected by our teeth, or I should say that our dental health affects our overall health. And we're going to learn a lot about this. It is time to get on point with our dental care. Joining me in the studio today are Doctors Todd Botwin and Dr. Maria Zecca Botwin, and they own On Pointe Dental Care located on Royal Palm Point in Vero Beach. Welcome to the show.
Thank you. Thanks for having us.
Yeah, I'm so glad to have you here. Sorry about that little flub in the beginning, but I just want people to understand how our overall health is tied to our dental health. We'll get to that in just a moment. Before we start talking about your practice, though, what made the two of you want to become dentists and open up your own practice? Dr. Todd, may I please start with Dr. Maria?
Of course.
Oh, thank you. We'll go ladies first.
Okay, well, I started working for an orthodontist when I was in college, and it was just a part-time job, but I loved it. I loved the tools, I loved the equipment, I loved the materials. And when I decided to go to post-grad school, it was dental school. And then I went there and I found my best friend and my partner, and it's just been great ever since.
Oh, that's wonderful. And how about you, Dr. Todd?
Well, I've always wanted to be in healthcare. I've always wanted to help people. I had a calling to that all my life. My brother was a surgeon as well, and I was going to work with him, be an oral surgeon. And I just decided to be a dentist and do as much oral surgery as I wanted to do. And we just love what we do, very much love. But really, I got to tell you the truth. My mother said I have two problems. She said, I have mouth problems and I have feet problems. Which one do you want to take care of, and I'll pay for it?
Oh, no, that's adorable. I love these stories. That's why I asked this question, because there's always something usually cute behind everybody's business, a cute story. Okay, so I mentioned in the intro that our overall health is heavily connected to our dental health. Now, I told you before, like what I learned about when you ignore, like what from an uncle that needed a valve replacement because he ignored a toothache for too long. So I learned that lesson through someone else, but our overall health is tied to our dental health. A lot of people don't understand that. So please go into that and just tag team off each other on this one.
Well, I find that the mouth is pretty much like a quick reference guide or even a dipstick to your body. Diseases manifest themselves in the mouth, vitamin deficiencies, all things can be, not all things, but a lot of things can be, like I said, a quick reference. We see a problem and then we address it and say, you should go see your medical doctor and follow through on this.
And that happened to me. I had a patient come in. We did a beautiful aesthetic case, 6 full crowns on the top and 4 on the bottom. And he came in about a month later. He was always overweight, and I'm looking at his gums, and they were terrible. And he said, these crowns, they're loose. And actually, his teeth were loose. And I said, wow, how is this happening? And sure enough, I said to him, I don't feel good about this. You need to go get a CBC done. And he did. And he ended up having diabetes. He didn't know. It was sudden onset, and he is, okay now, I think. It's been several years ago. But that's happened a lot where we'd had patients come in and their gums just didn't look right. And we would just order them to get a CBC with their medical doctor, and, they'd find something out, either heart disease or, blood disorder, diabetes. And that's true. It's a litmus test. We find out when things don't look normal, maybe it's something else.
Yeah, I do appreciate that. And I really want people to understand this, especially if people have been putting off going to the dentist for too long, which segues nicely to the next question. Sometimes people say, oh, it's just so expensive to go to the dentist, and they don't go. And then their hair is on fire because they have all of these problems. So my thought is, if you go once a year for that checkup, twice a year minimum for cleanings, you will probably, now anything can happen health-wise to anybody, right? But you're probably spending a lot less money in the long run with maintenance. So please help me out with this.
Well, with men, I give a wonderful example. You don't go get an oil change when there's smoke coming from your engine. It's a lot cheaper to get an oil change than a new engine in the car. So less stressful, less painful, and the money. So
yeah,
it's just maintenance. It is. You take care of your teeth. In the long run, they'll take care of you. But it especially in our practice, and this is our fourth practice opening up. We retired for 2 years, and we decided to just do it all again, only because we really love what we do, and we love educating our patients. And we always welcome anyone to come in and just come in and ask us a question. It doesn't have to be about, a fee or a bottom line, because thankfully we're at a position where we'd like to help people, and we'd like them to have their questions answered without worrying that, they're going to get given this big bill. Sometimes that's really, a fear factor too, is just going in there saying, okay, no, this is going to cost me more than my roof,
Right.
And that's daunting, So coming in, asking questions. Dr. B has large TV monitors in our operatories that he explains everything. He has, a past of being a professor at Northeastern Dental School. So, he loves that. And I love it too. And we appreciate doing that for our patients and our community.
Yeah.
Well, in our time off that we did take, she says 6 months, 2 years, but we really took about 6 months off, and we started working locum tenens in Florida. And we realized that there's a need for dentists in Florida, not corporate dentists. There's a need for people that sit and listen to you and you're not a number on your forehead. People that actually hear what you have to say, review history with you, and not just get you in and get you out. We just don't work like that.
Yeah, we wanted to
never
just
really work.
administer care. That's what we want.
And education, because with education comes prevent. And prevent is what we were talking about. Preventing heart problems, preventing expensive work. A filling's a lot cheaper than a crown and a root canal.
Yeah, and so that's the thing. And that's why going for a routine checkup, if people put something off, if they say, gosh, you know what, it's been a few years since I've gone to the dentist, then if they had gone, that little tiny cavity could have been, addressed very simply. Now, all of a sudden, they're in pain, and it's a root canal or a root canal and a crown, and so yeah, and so that's why I like the fact that you're not timing people. That's another thing with dental and doctor visits with large practices. I call it corporate. And
even though they're a large practice, not all corporate. Corporate is a certain model that they follow, and it's a different flavor. Our office that we had down south was a very big and busy office, and people said we worked together. Honestly, I probably saw him 10 minutes in the day because he had one part of the office, I had the other. But that's the thing. What he means by corporate is that it's really run by an accounting system as opposed to a care system. And I think that's important for anyone with their dental place to know who their dentist is and trust them and know that they're looking out for their best interest. That's one of the reasons why after, working, we thought, let's just be traditional in our approach to giving care.
Right.
And there are a lot of offices still that do that, and that's important because that's valuable. In the future, it's probably not going to be like that.
There's statistics saying that in 4 years, 88% of dentistry will be corporate.
Wow.
Which is a shame.
Yeah, I mean, It's a shame if when I'm sitting in the chair, if I feel that you're very rushed because the appointments are so stacked. And then if I feel like I can't ask questions, and especially, I hate to say it, like, younger people, like we think that when we're older, we understand all about dental care, and a lot of people don't. But when you're dealing with children, adolescents, young 20-somethings, you need to spend time with them to explain proper teeth brushing. They don't understand that.
That's such a great point, because I learned that, I think, I don't know how long ago, but a long time ago, that the teenagers I had in the chair, we were right next to a high school.
Mm-hmm.
So we got a lot of teenagers. And I realized when I would tell them, make sure you brush every night, and they'd be like, okay. And then they'd come back and I'd be like, you didn't brush. Like, yeah, I did. But it's like, you have to explain to them. So I'd get the toothbrush and spend 5 minutes showing them how to brush their teeth. They never even knew how to, because they may have been 5 or 6 when the pediatric dentist taught them.
Right.
But, now they're teenagers. Life has sped by them.
And speeding through brushing your teeth, sometimes people will do it once a day for like 30 seconds, 40 seconds maybe. They don't realize that it's like 2 minutes.
Right. Well,
it's supposed to be a minute per quadrant.
Right. Oh, a minute per quadrant?
Per quadrant.
Okay, so I'm not doing it long enough.
It's a long time, though.
I was going to say I'm doing, because my sonic care is timed, and it's a 2-minute cycle for my whole mouth.
Yeah.
So now I'm gonna. Yeah, is it okay?
Especially for mechanical.
Yeah, I think that the sonic care, it adds a little bit more than just the good old fashioned.
What mode you have?
As the mode.
Yeah, it took me a while to get used to it. I love my toothbrush now. It's like my favorite thing. Anyway, so what we're going to do is we're going to take a very quick break, but we have a lot more to discuss. But wait a minute, Cindy, guess what? I'm not taking a break. Guess what, Cindy? Don't press that button. You know what I want you to do for the first half is give your phone number and your address and your website, please.
Phone number is 772-257-6101. Our website is onpointedentalcare@gmail.com, and point has an E on the end. And what was the other question?
The address.
83 Royal Palm Point, Vero Beach, 32960.
All right. And with that, we're going to take a break. We'll be right back.
It's hurricane season. Prune your trees now with Scott Tree Services. Strengthen your trees against high winds and remove broken limbs that could cause damage. Don't get nervous. Call Scott Tree Services. Sturgis Lumber is the county's most trusted hardware store. Sturgis stocks stainless steel products, power tools, construction and painting supplies, propane, plumbing, and electrical parts. 4645 US 1 Vero Beach. Sturgis Lumber and Hardware.
If you operate a small business, you need services like payroll, tax compliance, HR tools, and other resources. You need Complete Employee Solutions. Vero Beach has a team of professionals, including Anthony Sammons, Matt McCain, and Jennifer Comer, who saw the need for competent payroll, HR, and employee leasing services. Call Complete Employee Solutions at 772-978-7277 or visit their website at CompleteEmployeeSolutions.com.
Summer's here, and it's a great time to create your outdoor room at Sunshine Furniture. Right now, during our summer clearance sale, you can save 10 to 50% on furniture from Berlin Garden, Lloyd Flanders, Woodard, Windward, Beechcraft, and more. We're the outdoor furniture experts and have any style of furniture that you need, all built to withstand the Florida elements, and we specialize in replacement cushions, umbrellas, outdoor rugs, and fire pits. Come in now for our summer sale, including 50% off all pictures, lamps, and accessories. Sunshine Furniture, $12.95 US 1 in the Publix Plaza, Vero Beach. Family owned since 1991. Visit our website at sunshinefurniturecasual.com and don't forget to shop our outlet store right across the street.
Sunshine Furniture brightens up your day. Sunshine Furniture, the best in every way. Have a sunshine day.
Welcome back to Treasure Coast Connector. I'm your host, Ellen Contreras, and I am with Doctors Todd Botwin and Dr. Maria Zecca Botwin of On Pointe Dental Care. And we're going to get on point with our dental care. I love that name. That's I love that. Okay, so now what I'd like to, we talked about like the importance of taking care of our teeth, but now I would like for people to understand the plethora of services that you offer, because your website, you have a lot of information on there.
We offer pretty much everything. Extractions, Invisalign, root canals, crowns, implants, partial dentures, pretty much anything that we feel comfortable to do. If we don't feel comfortable, we will not do it. We'll refer you to someone, a specialist, because ultimately your care, what's going on, it takes priority.
Right, and
We've
it
always
seems
lived that way.
inconvenient to do that, but the way we see it is, you know what, if you want good care, it's going to have to be by the right person, and if it's something that requires a specialist, it may be expensive, but you only want to do it once, and you want to do it correctly.
Yeah.
So, I'm not going to practice on someone. But in addition to all those things of dentistry that we do, he didn't mention the nice stuff like fillings and cleanings and
Cosmetic
bleaching
veneers,
and
yes.
veneers and bonding and a lot of fun stuff too.
Yeah. So then, but braces though you refer out, right?
It depends.
okay.
Some braces that, again,
the Invisalign.
we do
Invisalign
Invisalign type. Actually, we do a Bite, BYTE, and Sure Smile, which are similar to them, but a different company. Yes, it really depends on the case. Certain cases need to be seen by an orthodontist.
Yes.
Absolutely. Just can't be corrected by these type of retainers. Some don't.
And that's
Again,
something that would be assessed too. If it looks like, a different type of class or division of occlusion that cannot be, fixed with an aligner, we'll send them in for braces. And, and sometimes kids too, it really helps for them to start braces young because they do it in 2 or 3 phases. And, we've done a lot of kids, we've had a lot of kids that were patients that went through and their teeth come out great. They're just really
nice.
Hollywood smile, and they have to wear their retainers.
We've been doing a lot of whitening. We do in-office whitening and at-home whitening. We have disposable trays. We have trays that aren't disposable. We have, again, Dr. Z is wonderful with the 1 hour.
Yeah, we've done a lot of bleaching because we have a lot of new patients, and I bought a lot of product, and I said, well, that's nice of you to come in, and we've been doing that.
And what about the sensitivity? How do you help people with that?
Everyone's different. Some people have sensitivity to it, and we have different strengths of bleach, and we also have a desensitizing gel that you can use in addition to it that helps with that.
Very good.
But
It works well.
I find a good product that I enjoy.
Yeah, and your office is beautiful. So,
thank you.
So when I took that tour, when you had, the Vero Beach Chamber, grand opening, which was a lot of fun, there is state-of-the-art equipment. So I wanted you to explain what you have in there. But for the average person like myself, it's very pretty. It's very peaceful, beachy. So if you can talk a little bit about what people can expect when they come in.
The type of equipment we bought really just makes it easier for the patient. Instead of taking 18 individual x-rays, we have one that revolves around you. Instead of taking goopy impressions, we scanner type of thing. So we try to make things just easier, more convenient, less stressful for patients.
Nice.
Having 18 individual x-rays digging underneath your tongue or on your palate, it's a nightmare. No one wants to do it. That's why the majority of patients, I don't want x-rays. Could be the finances, but it also could be because the x-rays themselves are hurting.
Although, even though this machine, which is a CBCT machine, which is great, we love it.
And people are standing up.
And they're standing up. And
nothing goes in your mouth. It goes
around your body.
But there are some instances where we still do have to take the traditional x-rays to, get closer to look at something.
Things. Okay.
But, overall, it's been a great tool in our office, and patients like it, and, we're happy with it.
It helps us educate patients too. Really, I'm big with the education.
Yeah, you mentioned that.
Yeah, we like to make sure patient understands the treatment plan, what their options are. Get them part of the decision-making process. It shouldn't only be about how much can I afford. It should be about what do you need in your life, what's working for you, what will work for you.
Exactly. And the big screen TVs, it's not just for me to get lost in cat videos while you're working. Although people can watch videos, right, while you're doing the work.
Netflix, Vudu, Hulu, we have it all there.
Okay.
But what I use it for is I take your x-ray and I put it up on an 80-inch screen, and then I Google what a cavity looks like, and I put it up on the screen right next to it. So I'm not only showing you, I'm educating you onto, so you know in the future, that's a cavity. You know it is because it's black, or it should be white. So now I don't have to, explain. I could just
the
show
difference
you.
in the x-ray, what the colors are, and with the shape of it. And so, when we say this is why you have a cavity, sometimes people are like, it doesn't hurt me. How come I have a cavity? Well, it won't hurt you today, but like you said, in the future, it may. And, you can get it now when it's not going to be a big deal, or you can get it later when it might be a big deal. So
Nothing gets better.
Right.
It's
Exactly.
only going to get worse.
So that's why going once a year, at a minimum, for the dental exam, and then for the cleanings twice a year at a minimum, unless you have some other issues, and it could be
And things with insurance, usually it's free twice a year.
Oh
It doesn't cost you a dime. Exams, X-rays, cleanings, so it behooves you to go. Even if you don't want to listen to them, still go there and become educated.
Very good. No, I like that. And you do take dental insurance, which is good.
The majority of PPO.
Very nice. Okay, that's great. And then, what about the kids, the little kids, the babies?
Well, we've always had a philosophy in our office that even though we don't do pediatric dentistry per se, we do see children. And when we have patients that have children or very young children, we always invite them to bring their toddler in just to sit there and play with the stuff and get used to our faces, get used to the office, get used to mom or dad being worked on. So they know what the vibe is there. Babies see their pediatrician since day one. Usually a child, a toddler anyway, it would happen during trauma. They'd be rushed to the dentist, and parents are upset. They're upset. They may be bloody. Dentist is upset. Everyone's trying to find out what's going on. So if they're used to it, they'll say, okay, we're going to go see Dr. Todd and he's going to look at it. And they know there's a familiarity. Not that we, necessarily do the treatment. If it's a little bit too complicated or out of our scope, then we would send them to the pediatric dentist. But at least that they know it's a home.
Yeah.
And,
It's not a stressful environment. We put their camera on them and put it up on the TV so they can wave to themselves. We show their teeth on TV.
Yeah.
Anything that brings them closer, brings them, together with us and not fearing us.
Yeah, and that's the goal, to make a human that isn't afraid of the dentist when they get older. We talked about this.
Because I've mentioned it on the air, I've mentioned it on social media, that it is a scary thing. So she gave us 2 minutes. So with the last 60 seconds, what would you like to say to the people that are afraid to go to the dentist?
Say, don't be afraid. Like I said, it's only going to get worse. Just come in, let someone explain to you your options, and follow through with it. Because again, it's only going to end up in tooth loss.
Right. And if they wave the white flag and say, I'm coming up front and saying I'm afraid, right, that you will be extra gentle.
Absolutely. Come to the office, take a tour, see what we have, sit down and talk to us. Don't show us your teeth, but sit down and tell us what you're worried about.
Yeah, maybe an appointment before the appointment, if that makes sense.
Happens all the time.
Absolutely. Happens all the time.
Yeah.
Okay.
I mean, we even get people numb, not with the shop, but topically numb for cleanings on a regular basis, just to make life easier.
Okay. All right. Well, we only have a few more seconds, so I just want to say thank you very much for being here, because like everybody that knows me knows I was always afraid of the dentist. And you guys are not scary. You're very nice, and your office is beautiful, state-of-the-art equipment. So thank you very much for coming in. And I encourage everybody that's listening and watching, don't delay another day. See Doctors Todd and Maria. Call them today. The phone number again, real quick.
772-257-6101.
And it's onpointedentalcare.com with an E at the end of point. And it's 83 Royal Palm Point in Vero Beach. So go. Call today. My name is Ellen Contreras. I'm the host of Treasure Coast Connector. I hope everyone has a safe, wonderful, productive week. And until next week, I miss you already.